We'll grab our foam roller and our anti-burst ball to set up for squats. We'll use the wall as we step up onto the foam roller, bringing the ball between the inner thighs. Sitting back into a squat, swinging the outside arm into shoulder flexion, plugging the shoulder down the back. Try to not pitch your torso forward. You want your upper body to be on a diagonal. Tailbone through the crown of the head is an upward diagonal. Raise those abs, squeeze in on the ball, inhale, and come back up to stand. Let's try that again. At the bottom, we'll squeeze in on the ball and pulse in. Feel the bones of your big toes pressing into the roller and your feet are wrapping around it. Sit back and exhale, pulse in. 2, 3, 4. Inhale, exhale, pulse. 2, 3, 4. Inhale, exhale, pulse. 2, 3, 4. Stand up tall, arm comes down. Again, sitting back, swinging the arm up, brace the abs, squeeze in on the ball. 2, 3, 4. Inhale, exhale, squeeze. 2, 3, 4. Inhale, exhale, squeeze. 2, 3, 4. And inhale, prepare. Exhale, brace and stand up tall. One more time. Sitting back, use the bones of your big toes. Reach your sternum towards the back body. Brace the abs. Squeezing, pulsing in on that ball on your exhales. Preparing on your inhales. Pulsing again on your exhales. Staying conscious of all your checkpoints. Feet, inner thighs, abs, rib cage, shoulders, neck. Stand up tall, stepping off, holding onto the wall, being careful, and switching sides. We want to swing our other arm up for this one. So same thing, set up. Make sure the ball is between the inner thighs. The bones of the big toes are pressing into the roller as you wrap the feet around the roller like it's a bird wrapping its feet around a branch. And we'll sit back into that chair, tailbone reaching back, arms coming up. Hold, inhale 1, breathe. Exhale 1, inhale 2. Exhale 2, standing up tall, arms come down by the sides. We repeat with our pulses, sitting back, arm up. Retract those shoulder blades, pulsing in on the ball on your exhales, pausing to prepare on your inhales, bracing the abs again on your exhales. Standing back up after you've done 2 full inhales and exhales. Inhale, prepare. Exhale, sit back. Last set here. Pulsing in. 2, 3, 4. Inhale, 2, 3, 4. Brace. Exhale, 2, 3, 4. Inhale, 2, 3, 4. Brace and stand up. Stepping carefully off the roller. We'll keep the ball, placing the roller to the side, grabbing a 3-pound weight. Actually, let's use the roller. We'll place the ball between the knees, stepping back onto the roller, hinging forward from the top of the hips this time, taking the arm out slowly, lifting it up. 2, 3 for a back fly and down. 2, 3. Lift up. 2, 3 and down. 2, 3. Keeping the chin retracted, lift the arm. 2, 3. Think about puffing the upper back up, but not lifting out of your hinged position. So it's as if there were hands hovering over the shoulder blades and you were just trying to puff the upper back up to meet those hands. Brace the abdominal wall. Stick your booty out so your tailbone is reaching away from the crown of your head in opposition. Feel the feet wrapped around the roller, the inner thighs squeezing in on the ball. One more, lifting up on your exhale. Lowering on your inhale, brace your abs to bring your body upright and to carefully step off of the roller, switching sides. Setting up for a back fly on using the other arm. Hinge forward from the hips, soft bend in the knees at all times, bone of the big toes heavy, and begin lifting on your exhale, bracing the abs. Inhale to lower. Moving on a slow 3 count, taking it up. 2, 3. Inhale, lower. 2, 3. Brace the abs. Fog of air. Inhale, lower. 2, 3. Fog. Inhale, lower. 2, 3. One more. Inhale, lower. 2, 3. Let's step off very carefully. We'll place that 3-pound weight to the side, the ball and the roller, grabbing our heaviest Theraband. Stand facing me, but a couple feet from the wall so that when you take a quarter turn and you pull out on that band that's in line with your chest, you come into your piriformis pose, balancing, sitting back, dorsiflexing the foot that's crossed over. Isometric hold here. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3, soft bend in that supporting knee. Make sure that the bone of the big toe is heavy so that you're not rolling out on your foot. Stand up tall and turn back to face me. The important part here is taking a quarter turn and finding your balance immediately. You can lift into knee flexion and then move into this squat piriformis opener position. We did this in our opening stretch, supine, and now we're bringing it upright to get even deeper into that glute med piriformis. To keep the knee safe, dorsiflex that foot that's crossed over and press heavy into the bone of the big toe of the supporting leg. Let's switch sides. Setting up, step to balance, knee flexion, cross, sit back. Inhale 1, breathe. Exhale 1. Inhale 2, exhale 2. Inhale 3, exhale 3, and repeat. Take that quarter turn, crossing the ankle over, sitting back, bone of the big toe heavy. Inhale 1, breathe. Exhale 1, chin retracted. Inhale 2, brace the abs. Exhale 2. Inhale 3, exhale 3, and let's set that band to the side. We'll grab our foam roller, and if you have a pillow, or you can use your anti-burst ball, we'll come for a side-lying lat release. Place the ball to support the head as you come into this side-lying position, and you're going to play around with the feet, lifting the butt up and rolling forward and back, or doing a twist of the torso back to get into the fascia. The lat attaches under the armpit, so you're gonna feel a lot of fascia that's tight as you twist backwards posteriorly. So breathe into that as we open up this fascia. Couple more breaths, working into it. Inhale, play around with moving forward and back, twisting back and forward until you find a pocket of fascia that needs your attention. And then hold it on that fascia. Let's go ahead and switch sides. Setting up, moving forward and back, twisting, taking your time, breathing. It's up to you how much pressure you apply. So if you elevate the pelvis, if you really push down into the roller, you're going to get deeper into that fascia. But if it's really tight, you've got to be where you are today and use the breath and this roller to get a little more space so that the side body isn't tight and pulling you forward into that kyphotic position. From here, we'll get a chair and our heaviest band to move into an IT band stretch, taking the leg across the body, dorsiflexed, wrapping the band around the arch of the foot, holding the wall for security. The most important thing here is that the supporting knee is softly bent, the bone of the big toe is heavy, and that you stick your tailbone back, arching your low back so that when you fold forward, you're not putting pressure on the low back because you're tucking your pelvis, that you're getting a stretch through the lateral hamstring and your IT band. Breathing here. Inhale 1. And exhale, go further into the stretch, tipping the tailbone up and back. Inhale, brace the abs as you exhale deeper into the stretch. Inhale, brace the abs. Exhale, going deeper into the stretch. Inhale, and come up, switching sides. Setting up on the other side. Take the leg across the body, dorsiflex the foot. Stick the tailbone back. Soft bend in the supporting knee, bone of the big toe heavy. Each exhale is a chance to go deeper as long as your checkpoints, you have awareness. The feet, the bone of the big toe is heavy, soft bend in the supporting knee, dorsiflexed foot of the leg extended, internal rotation from the top of the hip socket across the body. Tailbone is back. Extension in the lumbar, abs are bracing on your exhales. Chin and chest are lifted, sternum is reaching towards the back body without causing the shoulders to round, so you're keeping the collarbone wide and plugging the shoulders down the back. One more breath here. Inhale, abs in, brace. Exhale, go deeper into the stretch and come on up. Set the chair to the side. Good job.